Hello everyone, I am Dr. Palanki Satya Dattatreya, a senior consultant in medical oncology in the twin cities of Hyderabad and Secunderabad. I work full-time in the Renova Soumya Comprehensive Cancer Center, and I'm really honored to be a part of this easiest exam campaign. This campaign is all about encouraging women to perform regular breast self-examinations. BSE is a simple and powerful tool which plays a crucial role in identifying breast cancers and some breast lumps early on, which help us in fighting this ailment and this disease extremely appropriately and most optimally. Today, I would like to talk to all of you about the importance of early detection of breast cancer. Breast cancer is one of the most important cancers worldwide, globally, and more so in India. We are now seeing an increasing number of breast cancer cases in women. The good news is, if diagnosed early and then if treated appropriately, the chances of cure in early breast cancer are extremely high. In the early stages, we are able to identify the lump or the disease at an earlier stage when it has not spread to any other organs of the body. And that's why, on one hand, the treatment is less aggressive, and on the other hand, the cure rates become extremely better. Appreciably, this can happen only if breast cancer is identified early. For instance, in stage 1 breast cancer, with the minimal of treatment, we can get more than 90 to 95% cure rates. But the key to early detection is regular screenings and being aware of the changes in your body. Early detection helps us to identify breast cancer when the tumors are early, localized, confined to only one portion of the breast, and have not spread to distant organs of the body. Detecting breast cancer early gives us the ability to identify when these breast tumors are smaller, have not spread anywhere else, and that's why the treatment becomes much less challenging. For instance, the surgeries are more localized and less invasive. The radiation treatments or the radiation fractions will come down significantly, and sometimes you may end up not getting any chemotherapy at all. In fact, only hormone therapy or endocrine therapy may suffice with some oral pills or simple tablets. And so it becomes very crucial to identify breast cancer early, because the goal of all oncologists treating any form of cancer is maximal efficacy against the disease, but to the patient, minimal toxicity. When detected early in early breast cancer, the treatments are more effective, more comforting, and less challenging for the patients, because we can now give treatment targeted only to that particular area of abnormality in the breast. And so, which are the ways by which we can identify breast cancer early on? Number 1, regular mammograms. Number 2, clinical breast examination by your family doctor, say once in a year. But most importantly and most easily accessible to all is BSE, or breast self-examination. And that's the crux of this easiest exam campaign. A self-breast examination is something which every woman can do in the privacy of her own room. By doing regular monthly breast self-examinations, a woman will come to know how her breasts look normally and how they feel, and also are there some irregularities in one breast when compared to the other breast. And that's why when some abnormality happens in any of the breasts in the form of either a small lump or a bump or a tumor or a swelling or some skin changes, then these can be identified only if regular monthly breast self-examinations are being done. Many women who have identified breast cancer early in themselves have done so only by paying attention to these small changes which they were able to identify only because they were performing regular monthly breast self-examinations, and when they picked up those changes, they went back to their family doctor, and that's how they identified breast cancer early. Of course, I'm not telling that breast self-examination is going to replace clinical breast examination or regular mammograms, but breast self-examination is a very healthy habit to form, and in fact can become the first line of defense in this crusade to cancel cancer. Please remember, detecting breast cancer early truly saves lives and cures millions of breast cancer patients across the world. The easiest exam campaign urges all women to make sure that regular breast self-examination becomes a routine part of their daily lives. It takes just a few minutes but could make all the difference in detecting and catching breast cancers early. And that, as we all know, is the key to treat and cure early breast cancer. Remember, breast cancer is curable if detected early and treated appropriately. And so I urge you all to take the easiest exam. It's quick, it's easy, it's approachable and accessible to all women across all walks of life. For more information on how to perform a breast self-examination, please log on to www.easiestexam.com. Let's break the silence around breast health and encourage every woman to perform regular breast self-examinations as a priority in their day-to-day lives and their daily routines. Together, we can make a difference.